Good morning, everyone. Thank you so much for joining me here on Wave Now. I'm Myra Ansari. So we're talking about addiction today and recovery. We have seen, I'm sure you all have been, someone, maybe you're struggling with addiction. It's something that is impacting our community everywhere. So today we're teaming up with Brightview Health. They're an addiction recovery center here in Kentucky. They have several locations actually across the country, but they're celebrating a major milestone of helping 5,000 people in Kentucky, which is a huge achievement. So joining me now is Crystal Barajas, the Community Outreach Manager for Brightview. Crystal, thank you so much for being here today. 5,000 folks, that's a lot of people. Tell me about the stories of how lives have been changed.
Yeah, thank you so much for having us. We're really excited to share about how we've been able to help over 5,000 patients recover from substance use and alcohol use disorder. So we really work with our patients. Every journey is different. So some patients may need more hands-on help and others may not need as much. But we work on them. It's a fully comprehensive treatment plan based on what their goals look like and what their needs are. So there may be some justice system involvement where we need to help them get their kids back, or they may need help with primary care referrals, a dental referral, just things of that nature, getting a job, housing, transportation. So there's so much to it, more than just showing up and putting the work in therapy, but our case managers and our team here at Brightview do so many amazing things for patients.
Getting help is a big step for a lot of people. It's not easy.
Mm-hmm.
We cannot underestimate the strength that it takes to walk into a facility and say, you know what, I suffer from an addiction. What are some of the things that people come to you for that they're trying to stop using?
Yeah, so we serve any patients that are struggling with alcohol and substance use. So that can be methamphetamines, it can be cocaine, opioids, and then of course alcohol. There are 3 different ways that we can accept a patient. They can go online and schedule an appointment with us. They can call our 24/7 access center. And then one amazing feature that we have is treatment on demand, which means someone can come in between the hours of 8 a.m. and 3 p.m. and see a medical provider or a clinician, and a clinician, I should say, and get started with their treatment on day one. In this field, this treatment space, it's vital that when someone is ready and they're looking for help, that there is help available. So we love being that provider that can see them on the first day and get them set up with services and kind of get a game plan together for what their road to recovery looks like.
I think we are changing our mindset when it comes to how we define addiction. This is something more than, it's very complex, right? I've read things that this is really a disease that folks suffer from.
It is.
Tell me about how we look at addiction now.
So there is, unfortunately, there's still a lot of stigma surrounding addiction, even with all of the scientific data that backs up that this is a disease. Just like diabetes, you're going to your doctor and you're getting your medicine. This is the same situation. So there's still a lot of education that we need to provide for the community, that this is not a choice. This is in fact a disease, and it does need to be medically treated as such.
I was on your website and on your YouTube page on Brightview Health. You all share stories of patients that have come through your doors. And honestly, hearing some of those stories was so emotional for me to hearing them talk about. There was a mother who, she said that she had been using opioids and, she was so out of it that she wasn't able to give her 1-year-old baby a bottle, and she didn't want her children to find her dead on the floor. That's what she was scared about. Mm-hmm. You talk about stories. People hit rock bottom really when they decide, okay, I've had enough and I can't do this. Tell me what things people are struggling with, whether it's losing a job, losing family, you may have lost your kids. it's heartbreaking.
It's really all the above. I mean, when you're talking about addiction, again, everyone's road is different. I have a patient here that she was a wife and a mother, and was able to hide her addiction from her family for years, and to the point where it got a little bit out of control for her. She was no longer able to hide it. She called us looking for help. She said she had an 8-ball of cocaine in her hand and her phone in the other, and was looking for places to help her. And Brightview was the third place that she called, and she feared that had she not been able to find, Brightview, that she would have, unfortunately, probably would have taken the 8-ball and overdosed. And that was actually laced with fentanyl at the time. So fentanyl is very prevalent in all areas of Kentucky, definitely here in Louisville and throughout the country. So that is one thing that we're really trying to work on with our patients is they're saying they're, on heroin, and when they come in, they're actually testing positive for nothing but fentanyl.
Wow. A lot of folks may think, Crystal, I can shake this cold turkey. I'm just going to stop. I'm going to wake up tomorrow morning. This is the last time. How many times have you heard that? And how likely is that to happen?
This day and age, it's so hard with the drugs that are out there that are being laced with very potent drugs. It takes so much support and help, layers of support. Here at Brightview, they're seen 1 to 3 times a week, depending on how often they're willing to come in and put in the work with therapy and group therapy. But we try to layer that with, hey, here's this AA meeting or here's this NA meeting. Celebrate Recovery is a great option. And then just trying to bring in the family for extra education and support, so that way they understand that it's a disease and how they might be able to help them. But, whether this is the first try or the 20th try, we are still going to help you. And that's what, most providers are the same way. And, we understand that sometimes this takes more than a few rounds in recovery for something to stick. One thing that I always like to point out is, once you finish that inpatient stay, that's wonderful. And we are so proud that you took that step, but keep it up, find a sponsor or continue that work in therapy. Because without all those layers of support and some accountability, that's really easy to get back into former habits.
One of the ladies that went through your program said, you may not like what they hear, but that's part of it. That's part of hearing the tough things, right? And the end goal is just to get people better.
Sure.
What?
Yeah, absolutely. One amazing thing that I always love to point out, especially with hitting this awesome milestone of 5,000 patients. We started in Kentucky at the end of 2020. We opened our first doors at Brightview. And over the years, we have grown to 17 locations. So with that reach, it's amazing. We love being able to help over 5,000 people recover from substance use and alcohol use disorder. But what we also find is that our patients at Brightview have seen a decrease in arrests and justice system involvement, as well as a reduced use of emergency medical services. So it really kind of ties into all facets of the community of when someone's able to go and get recovery, the whole community can actually feel the impact of that.
Talk to me about when someone walks through your doors. How do you get them on the path to recovery? We talked about medication. Sometimes you need medication. One of the ladies that you all had worked with used Suboxone. Tell me how you get people on the road to recovery.
Yeah, so it's up to the person on if they're interested in medication-assisted treatment. Here at Brightview in Louisville, we do offer Suboxone, Vivitrol, Sublocade. as well as methadone. So 4 different options, and they're all very different, and can work for some and others it won't. Our medical provider will determine what's best for them based on their assessment. So we'll go through an assessment with them, ask them questions, what's going to work for them and what's not. They'll make their recommendations based on that. Depending on when their last use was, they may be able to get started on medication the same day. Otherwise, we'll give you some comfort meds, help those withdrawal symptoms, keep you feeling better. And then we can get started on medication-assisted treatment. From there, they develop, once you're feeling better, then we'll work with the clinician and the case management team to really narrow down like what's going on and how we can help you. Case management layers in all kinds of support and helps remove barriers. So depending on what those barriers might look like, again, it could be transportation, it could be something as simple as a primary care physician referral, food pantry items, clothing. We see everyone from people off the streets to people that are, working jobs. So our teams at our sites are so dynamic and what they can help our patients with. It really just depends on what's going on with the person. And from there, they personalize it based on their assessments.
I may be saying some of this wrong, so correct me, Crystal. When it comes to addiction in Kentucky, how do we fare across the country? It's my understanding that some numbers are down, and that's a great thing. Is it because of places like Brightview?
I would say yes. I know that, I don't have all of the information on that, but I have heard the numbers are down, but we are still seeing so many people and, come through our doors.
Okay, so I was actually on my phone trying to look for it. So here, I found it. Mm-hmm. According to the CDC, Kentucky overdose deaths were down 3% from 2022 to 2023. That's better than the national average of 2.3%. Of course, still a lot of work to do, but we're kind of thankfully heading in somewhat of a right direction.
Yeah, absolutely. I love to hear that the numbers are trending down. I'm not sure if that's, just more use of Narcan, people getting more educated on Narcan. I'd be curious to see what those numbers look like on how many people are actually getting trained on Narcan and using Narcan versus, in their lives being saved.
Is it also just people getting help?
Oh, absolutely. I would imagine so, yes.
Okay, so there are people that are out there watching right now, Crystal. Mm-hmm. They may have a loved one who's struggling with addiction. They themselves may be struggling through addiction. They may feel like, okay, I need help. I don't know what to do. This is so overwhelming. This is consuming me. My life is just escaping me. What would you say to them, Crystal?
I would say, we're here when you're ready. There are so many layers of support, not just with Brightview, but the whole community across the city of Louisville and the state. There are so many wonderful people that recognize that this is a disease, and we're wanting you to help, change your life and live a different way so you can have a better quality of life. So that way you can, be present with your kids or be present at your job, get help. We're working so hard on reducing the stigma that surrounds this disease. And we want to, be that provider or get you connected to a provider that can help you.
And you had mentioned this earlier, Crystal, whether you've tried it one time to quit, 2 times, 3 times, 10 times, if you're here, you still have the opportunity to make that choice. Don't be ashamed at the times that didn't go well. Look forward and think, okay, how can my life be different? Tell me some stories about how lives were changed, things that you've seen, your clients, your patients come in, they had hit rock bottom and now where they're at now.
Yeah. One really cool thing that happened just a couple of weeks ago was I came in, I'm the community outreach manager, so I don't spend a whole lot of time here at our center, mostly out in the community, just spreading the news of all the great services that our team here provides. So when I get to hear these stories, it's extra special. one of the guys that I had actually got in probably about a year and a half ago, he was like, "Oh my gosh, Crystal, like, I'm in phase 3 now." So some programs have different phases. Ours is phase 1, phase 2, and phase 3. And phase 3 is where you start coming monthly. Things are you're not in crisis anymore. You're stabilized. You're coming into therapy once a month, group therapy, and then seeing our medical provider for maintenance for medication assisted treatment if that's their journey. So he was just overwhelmed with joy to share that, and he's back at work and he's getting his kid back. So it's just hearing stories like that where they're able to be productive and gain that quality of life back and get their kids back. That's why we do what we do.
Okay, so in this link for folks, I have put Brightview's website on here if you want to check it out. Crystal, if people are scared, I don't have the money, I don't have the resources to get help. How do you all approach that?
Yeah, so most patients are eligible for Medicaid. And so if you're not on Medicaid, then our case managers are able to connect you. Most of the time you can be signed up for Medicaid within 30 minutes. Our team works really quickly. There is a self-pay option, and then there's commercial insurance options as well. So we really work with you on all of that. Again, if money is an option, then or barrier, we work on, like, let's get you a job, let's get you stabilized, start working on your resume and getting you out there. And we find there's a lot of really wonderful employers that are willing to help our population out. So our case managers in each area are connected with those wonderful community partners and help our patients in the right direction.
All right. Okay. So the big thing is, and also I want folks to know that, as Crystal had mentioned, if you're scared, well, how long am I going to have to wait? Am I going to have to wait 2 weeks to get in? Am I going to have to wait? The good thing about Brightview is you call them and you get in very quickly, right?
Yeah, I mean, like I said, sometimes same day, depending on when they call, or at the very least, the very next business day. So we're able to see walk-ins from Monday through Friday from 8 a.m. to 3 p.m. And that's not just here in Louisville, that's across the state throughout our 17 centers.
Okay. Crystal, is there anything that I did not ask you that you want folks to know about today?
Let's see. Really just the opportunity to be on here. I'm just really grateful to spread the news of Brightview and all the wonderful things that we do here. Don't be afraid. We're here to help you. You come in and you're treated like family. I love walking into the site and our team knows every single person by name. I mean, it's truly a family atmosphere. If you come in and you've been here with us and you suffer a relapse, no worries. Like, we're here to still help you. We're not a punitive program. We're going to work with you and get you back on track. So there's just a lot of wonderful things that Brightview offers, as well as so many providers here in Kentucky. So, if one provider at one rehab place didn't work, that's okay. We'll get you connected to a different provider. So it's just important to keep going and keep trying.
All right, Crystal, thank you so much for all that you do. I appreciate your time. Again, Brightview Health's website is there on your screen. Please get some help if you are struggling. There's a community out there that supports you and that loves you, and your life is worth it. So please get some help if you need it. I'm Myra Ansari with Crystal Barajas from Brightview Health. Have a great day.